Lee Jones specialises in international politics at Queen Mary University in London, and he joins us now live from London. Tell us, China has faced a lot of criticism about not being transparent regarding the outbreak. What have been the consequences of this?
Well, I think it's provided major embarrassment for the Chinese central government. I think it's important to emphasize that one of the reasons why China was not transparent enough to begin with was partly because of local governments in China, which have a great deal of autonomy from the center, were basically covering it up and not passing on the information as required. So it's produced a lot of embarrassment from the central government and a desire to be seen as more cooperative. But I think by and large, attempts by the United States in particular to blame China as the origin of the virus, President Trump calling it the China flu or the China virus or even Kung flu. This has really politicized the pandemic between countries, made it into an international conflict. And of course, the Chinese responded by saying, well, maybe the virus leaked from a US bioweapons lab. And so I think this has actually been quite detrimental. The politicization of the pandemic also led to delays in the WHO declaring it a pandemic of international concern, because instead of acting as neutral scientific representatives, the representative there of the United States and China acted as representatives of those countries. So the sort of emerging Cold War, if you like, between China and the United States has really shaped how the pandemic has been managed at the international level.
And so that question, that is floating around, how does one build a more robust global system for transparency and to deal with any future pandemic?
I think it's very difficult. I mean, we have to realize that we did have a system in place. The 2005 international health regulations of the WHO, which everybody had signed up to, already existed. There was a pandemic governance system in place. The issue was it wasn't implemented. Countries generally did not develop the domestic capacities needed to manage a pandemic on this scale, despite the fact that on paper they were doing so. I mean, look at the United Kingdom, for example. It's supposedly the best prepared country in the world, but it's one of the worst prepared in practice. So a lot of on-paper preparation, and a lot of countries have just not made the necessary investments in capacity. And so I think for all the talk of needing a new international instrument, as Tedros said there, what we need is a greater link between the democratic systems domestic systems in countries and these international agreements. The problem is these international agreements might look very good on paper, they'll be very well designed by technocrats who know what they're doing. There's no public involvement in that. There's no democratic debate. There's no ratification by domestic parliaments. And so there's just a mismatch between what bureaucrats are doing in their international discussions and then implementation on the domestic level. These things need to be more part of our domestic politics rather than always looking to the international level to solve these problems. The problem is always where the rubber hits the road, where international agreements have to be implemented in the domestic political sphere.
But it doesn't look good, does it? Just to say, look at Europe, for example, right now, France with over 300 cases. The continent can't even agree on how to deal with Omicron.
Yeah, and this is why we shouldn't just point the finger at China. I mean, China has made serious mistakes, I think, and it's continuing to make a serious mistake in pursuing zero COVID policy and basically keeping the country in a series of rolling lockdowns. I think that's, there's no real scientific basis, I think, for keeping that going, and it's entailing serious human rights abuses. But mistakes have been made across the board in all kinds of countries. Europe has had very high incidence rates, and it showed that its neoliberalized, hollowed-out healthcare systems are not really well placed to cope with, even with seasonal flu pandemics, flu epidemics before the COVID hit. And the NHS in the UK was falling over practically every winter.
And we've just spoken to a GP. We've just spoken to a GP on this very issue. So it really is a sign that the country cannot cope. Lee Jones, we will have to leave it there. Thank you very much indeed for your time.